Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about rheumatic fever in English. The word rheumatic means connective tissue and joint severe pain. The connective tissue as well as in joint, there is a severe pain which is known as rheumatic. The fever which is increase in body temperature. Generally, we know that's only the fever, the general increase of the body temperature due to entry of any microorganisms. An inflammatory disease that can affect brain, heart, joint and skin. It is known as rheumatic fever. Any inflammatory disease which can affect the brain, heart, joint and skin. Now we will see the etiology of this rheumatic fever. It is caused due to mainly streptococcal bacteria, in that group A beta hemolytic streptococci. This is the important thing which causes rheumatic fever. Now the transmission, it is due to direct contact or genetically it is transferred. Now you will see about the pathophysiology of the rheumatic fever. The streptococci looks similar to our connective tissue component. When the streptococci enters into the body, this streptococci and our connective tissue components look similar. So that, for example, the streptococci M protein is similar to our actin and myosin of the muscle cells, and it is also similar to keratin. The hyaluronate capsule, which is similar to hyaluronic acid in our joints. The blood also helps in transporting the bacteria from one area to another due to molecular mimicry. Due to the similarity of the both streptococci as well as our body cells or body components, the blood also transfers the bacteria from our one part of the body to the another part of the body due to the molecular mimicry. The streptococci M protein as well as actin and myosin M protein looks similar, which is known as molecular mimicry. The similarity between the streptococci as well as our connective tissue component are similar, so that this blood also helps in transferring of the bacteria to other part of the body. The bacteria damages all the area, mostly connective tissue. Due to the transferring of the bacteria destroys all the area, so that our immune system provides immune cells to destroy the bacteria, but our immune cell gets confused and destroyed our own cells too along with the bacterial cells. Due to that, this results in autoimmune disorder, and this is known as rheumatism. This pathophysiology is known as rheumatism. Along with it, the fever comes, so it is known as rheumatic fever. Clinical features. Mostly it occurs in the age of 5 to 15 years. In India, 3 per 1000 children are affected. Now we will see about the diagnosis of the rheumatic fever. The diagnosis of the rheumatic fever is done by using John's criteria. There are 5 major criteria as well as 5 minor criteria. The 5 major criteria are carditis, polyarthritis, Sinhan's chorea, which is involuntary movement of legs and hand. It is a nervous disability, and erythema marginatum and subcutaneous nodules. In minor, fever, polyarthralgia, which is joint pain, previous history of rheumatic fever, and prolonged PR interval in ECG electrocardiograph. There is prolonged PR interval. Along with it, there are other 3 minor criteria are ECR level increased creatine protein, and leukocytosis. To say the person is suffering from rheumatic fever, the patient should have any of the John's criteria, which is 2 major criteria in the John's criteria, as well as 1 major or 2 minor criteria. In that, when the patient has any this 2, and he is concluded to be suffering from the rheumatic fever. Now we will see about the treatment of this rheumatic fever. First one is primary prevention, which is to destroy the streptococcus by using antibiotics like penicillin, erythromycin, and ethyl succinate. Primary prevention is mostly by to destroy the primary. Due to the entry of the streptococcus only this rheumatic fever is caused. So to destroy it, it is known as a primary prevention. It is used by antibiotics like penicillin, erythromycin, and ethyl succinate. Anti-inflammatory agents like steroid and NSAID, which is non-steroidal anti-inflammatory agents, are given. Supportive treatment is given, and secondary prevention is done. After the cure of the rheumatic fever also, to 10 to 15 days, the course of penicillin and erythromycin is continued. That's all about the treatment of the rheumatic fever. Thank you. If you like this video, please to like, share and subscribe my YouTube channel. If you have any doubt on it, please to comment it. If you want another topic, please to comment it. Thank you. Please to subscribe.